Okay, our final presentation for this session is Caitlin's talking about exploring and building the role of the peer workforce in supporting healthy lifestyle. Thanks, Caitlin.
Thanks so much, Chris. Hi everyone, my name is Katie Fehily and I am an early career researcher at the University of Newcastle. So I'm a part of the Fehily research team that's led by Jenny Bowman, and all our research really aims to improve the physical inequity that's experienced by people with mental health conditions. And we have a particular focus on prevention. I feel really lucky to have the opportunity to be here today and to hear about all the fantastic work and initiatives that's happening in this space. And I'm excited to share with you a little bit about some research that we're just starting out on at the moment. Before I begin, I would like to acknowledge the traditional custodians of the lands across which we meet today and pay my respect to elders past, present and emerging. So the project that I talk about today is one that our team are currently working on that's supported by some seed funding from the Alive National Centre. And it's looking at ways to be building the role or looking at what the role is for peer workers in supporting healthy lifestyle. And it has a particular focus on smoking, nutrition, alcohol and physical activity. I just want to mention too, we're only just starting on this research, so we haven't finished it yet. So I'm just going to be sharing a little bit about how we've been going with it and some of our next steps. And I have already learnt so much today from some of the other fantastic presenters in this session and the other sessions today and the workshop just before this. So I can definitely see ways to be integrating that within this work as well. So although it's me presenting today, it's not just me doing this research. So I just want to acknowledge that there is a large team behind us who are involved, and just wanted to highlight a couple of the people, including people with lived experience, peer workers and peer workforce managers across the 3 local health districts that are collaborating with us on this project. So we have the Central Coast, Hunter New England and the Mid-North Coast. So I guess the reason behind this research is the reason that we're all here today to help address the physical health inequity that is experienced by people living with mental health conditions. And there are many, many contributors to that inequity that we've heard about today. But one of those is lifestyle behaviours. So things like those on the screen, so smoking, nutrition, harmful levels of alcohol consumption, not getting enough physical activity, and also poor sleep. So this research, and a lot of the research of our team, takes a prevention focus, so looking at ways that we can be supporting and encouraging healthy lifestyle for people with mental health conditions. So to do this, a lot of our team's work has focused on helping different services to be able to provide support for healthy lifestyle. So looking at the different types of mental health and other health services that are being accessed by people with a mental health condition, and looking at ways that we could be helping those services to be systematically and routinely including healthy lifestyle as part of the conversations that they're having with people and part of the and of course this is really important because I'm sure it's no news to anybody here, but we know that people with a mental health condition are very interested in improving health behaviours, and that they do want and expect to receive support from mental health services around this as well. But it may not always be provided, or there could be some potential to be increasing or improving access to that care. So some of our past research has involved working with different services and trialling some different approaches to increase the delivery of healthy lifestyle support across both government and non-government mental health services and in hospital and community settings. And some of the learnings from that work was around some of the different strategies that can help to promote practice change in this space. So things like tools and prompts that health professionals might be able to use, like some of the ones that we've heard about today, as well as training for clinicians to help increase their capacity in this space. So that's just, I guess, a bit of an overview of the kind of lens and work that's kind of come before this. which really brings us to the focus of this research, which is around considering peer workers as a really important part of that mental health system. So thinking about peer workers who bring their own experience, lived experience of mental health conditions, and draw upon that in their role in supporting people. Of course, the peer workforce is a growing part of the mental health workforce, and it's incredibly important to be considering their role as well in supporting healthy lifestyle. And of course, peer workers bring many unique strengths and skills to the support that they provide. So some of the things are highlighted on the screen here, for instance, around peer workers being able to be powerful role models for behaviour change, and able to understand and really respect the challenges that may be faced by the person that they're supporting. And the ability to walk alongside the person and share their own experiences to be building resilience, building a sense of connection and belonging, and empowerment as well. And there is some growing research now that's building the evidence base for peer-delivered interventions for physical health, including healthy lifestyle as part of that. So I think it was at last year's Equally Well conference that David Castle presented a little bit about this systematic review I've got on the slide here, indicating that peer-delivered interventions are helpful and can enable positive health outcomes for people, such as increase in physical activity. So I guess the next step now where this research comes in is looking at ways that we can be translating these positive findings into initiatives that enable the peer workforce to be considering healthy lifestyle or providing healthy lifestyle support. And so in this context, I guess the overarching aim of this research is around designing support strategies for peer workers to help enable them in providing that healthy lifestyle support. And the focus is on peer workers specifically in the government mental health sector. So again, just wanted to highlight the 3 LHDs that are collaborating with us on this project, the local health districts. So we've got, I don't know if you can see you can't see my mouse, sorry, but this is just a little snippet of New South Wales. So for those that aren't familiar, just to show where Hunter New England, the Mid-North Coast and the Central Coast are located. Okay, so this research involves 2 key stages. So the first is around, it's just understanding current practice. So thinking about what are the current experiences and perspectives of people accessing mental health services and peer workers about peer-delivered support for healthy lifestyle. And then this initial stage will then inform our second stage, which is where we're hoping to hold some co-design workshops to develop some suggestions and ideas for different strategies that might help peer workers in this space. So very much informed by what we've learnt in that first stage. So just stepping into each of those stages in a little bit more detail. For the first stage of the research, again, this is just our kind of current, our initial activities to understand current perspectives in this area and people's experiences. And so we're just partway through this, so we're just starting out. But this really began by having lots of group discussions with peer workers and people with lived experience, both together and separately. And then from that came 2 key research activities that we've started working on now. So some one-on-one qualitative interviews with peer workers and a survey of people who are accessing government mental health services. Questions or key kind of parts of what we're asking people are just highlighted on the slide. I'll just go through them. So questions around, from peer workers' perspectives, for instance, what support might they already be providing in this space? How do they feel about providing that? So is it something that people feel confident and comfortable with doing, or is it maybe not so much? And then from the perspective of people receiving that support, what would they actually like to receive? What should that healthy lifestyle support look like, and what shouldn't it look like? And then if they maybe did receive some support from a peer worker, what did they think about it? Was it actually helpful? What were the pros and cons? What were the good parts of it? And just generally learning about some of the different values and benefits of peer-delivered lifestyle support. So as I mentioned, we're only partway through this stage, but I did just want to share with you a little bit about some of our learnings so far. And I'm sure there will be many, many learnings that we add to this as we go along. But really what's come through strongly is that people do feel that peer workers could be having an important role in supporting healthy lifestyle. And some of the reasons why really mirror what I shared earlier that comes from the broader literature, but it's things like the fact that peer workers help someone to feel understood so they can be relatable. And they bring that knowledge of the unique challenges that someone faces. So they might know, for instance, that it's not as easy as just getting up and going for a walk, or it's not as easy as just quitting smoking, and that there's unique challenges along the way. And also one of the other things that came through really strongly so far as well is the time that peer workers bring to that too, so that it's felt that they may have more time to be creating a space to sit with someone and to listen and therefore help. But it's also been raised that it's important to be mindful of each person's unique recovery journey and where they might be on that journey. So that's in terms of thinking about when healthy lifestyle support might be provided and what that person's individual goals might be. There's also been some differences among peer workers about whether or not this is something they might already be doing. So some people are sharing that healthy lifestyle support really is part of what they're thinking of, whereas for others it's maybe not so much. There seems to be a little bit of differences so far in what we're finding. But there has definitely been peer workers wanting more training and resources in this space. So particularly for people who weren't already providing healthy lifestyle support, wanting some clearer guidance about, well, what are the steps? What could that look like? What are my roles and responsibilities in this space? And there's also been some considerations raised so far. I guess this will probably come more into the second stage when we do some workshops, but just so far people raising, for instance, that there might be differences in people's experiences that could impact here. So people having very different experiences of mental health conditions or different health needs. So for instance, a peer worker might be supporting someone who is wanting to quit smoking, but the peer worker themselves isn't a smoker or hasn't been a smoker before. And so I guess that might impact their ability to provide support that's informed by their lived experience. And so one of the suggestions that's come from that is maybe there could be some matching of people based on similar experiences, but I'm sure that will kind of come out more as the project goes forward. And I guess just acknowledging too the importance of ensuring that whatever's developed is consistent with the defining features of peer work and not moving to a more clinical approach to healthy lifestyle change. So once we've completed that initial first stage, learning about current practice, the second stage will be to hold a series of workshops with peer workers, people with lived experience, and possibly also some peer workforce managers as well, to consider all those findings, all the learnings from stage one, to help us interpret and understand them. And then to, number one, be thinking about, well, from that, what should peer-delivered healthy lifestyle support look like, and consider what that might involve. And then two, what strategies might help enable the peer workforce to be providing that support. I put some examples on the board, but I guess we really don't know what these might be yet. It could be things like training, resources and guides, but they're just examples. So So where to from here? We're really hoping that this research will contribute to recognising and building the role of the peer workforce in mental health settings, and could possibly lead to some future research around trialling and evaluating what is co-designed in those workshops, thinking about whether they might be effective, for instance. But we're very much hoping to write up the results of this research when we've finished it into a publication and be able to share that as well. Thank you so much, everybody, for the opportunity to present today.
Thank you. Questions?
I have lived experience, and I'm very interested in lived experience driving a lot of these programs. But I'd like to ask, say with exercise, if you're encouraging, do people need to be checked out by an exercise physiologist or a clinical person before they start an exercise program? Or would the peers just say, well, start walking, or maybe you could start dancing, or how does it work
So
in that way?
that's a really good question, and it's I think part of what we're still yet to work out and falls into that idea of where do the roles and responsibilities of people lie and what are the roles and responsibilities of peer workers here. I think from what we've heard so far, there's definitely potential for peer workers to be able to be recommending at least connections to people who might be able to facilitate more specialist advice if that's needed. But there could be some, we've already heard about some great initiatives that are being ran and walking groups and things like that that people might be able to be connected with that are already kind of happening. But yeah, I think that's a good question and relates to some of the other behaviours as well. So not just physical activity, but things like nutrition too. Sometimes people might need a little bit more specialist advice from a dietitian, for example.
Hi, Megan. I'm really interested in the, following on from that question, the ecology of this, right? So, like a government-based peer support program that is socially prescribing things, right? So, how does it fit with, say, if we do, if we're following ABCD stuff, you've got walk and talk, you've got, boot camps, you've got social enterprises that offer stuff. Could it fit into that landscape and provide, close the equity gap between people you pay for things? Or would it be like government standalone with a higher risk profile and sort of referred to from a clinical point of view?
So I think if I understand your question correctly, sorry, it's around whether this could be integrated with some of the programs that are already existing or happening in the peer.
Yeah, so communities have programs.
Exactly.
Yeah, that cover a lot of this.
Exactly, and I think that's the hope, that we can be, this might be something that isn't, I guess, an extra standalone thing, but something that's integrated and considers what might already be out there, what could people be connected to, or increasing awareness and access of those different initiatives and helping people, assisting people in accessing those for sure. So yeah, not thinking that this would be like a really specialist program or initiative, it's something that could be I guess, offered to as many people as possible and about increasing that access to healthy lifestyle support.
There's one on the other side of the room, isn't there? Just make me walk all the way over there. I guess get my steps up. Yeah, good-o.
As a fellow Newcastle person, I find it really interesting philosophically that we might be asking peer workers to, in a sense, start an intervention. It's interesting space to be in and whether or not that actually is the role of peer workers. But then you could say that maybe recovery, physical health, is part of recovery, but then we need to work in the lived experience space because it isn't. We don't think of lived recovery in terms as much in terms of physical health. Just a floating comment.
No, thank you. That I think is a really good consideration and reflects, I think, some of the discussions that we've had so far with peer workers in ensuring, again, that aspect that this doesn't deviate from what peer work is and always being driven by what the person's goals are and what they would like support for sure.
Thanks. Sorry, just as I guess kind of like a follow-up to that, I was just interested in finding out where the peer workers were actually working. Are they working in acute units? Are they working in inpatient or in community? And what proportion? Because I think that would also have an impact on the kind of strategies that they'd be able to use, or even if that is actually part of their role.
Yes, that's another great question. And yeah, it is a mix at the moment. So we have peer workers who are working predominantly in an inpatient setting, or people who are providing support to people after they've been discharged from a hospital setting. So they might be supporting people to be accessing other community supports after they leave hospital. And then we do have people working purely in a community setting as well. So it's very much a mix of different perspectives. And I'm hoping once we get some more more perspectives and more people involved, we'll be able to tease apart a little bit more some of those differences and what might work better in different settings.
One more question. It's all the way out the back, of course.
It's a comment more than a question. Having been a peer advocate or worker since 94, I go to a person and say, what do you need and how can I help you to get there? If they say they have if they're not happy with their physical health, then I'll connect them with a clinical service. But that is not my role as a peer worker. My role as a peer worker is to talk to the person as an equal and say, what do you need? If I come in suggesting what they need, I'm going from that top-down approach. And that's not what peer work's about.
Okay, thank you everybody for maybe join me in thanking Caitlin for that excellent presentation.